Tell me a bit about yourself.
Hi, my name is Chhaya Chauhan, and I have recently had a beautiful baby boy. So I'd like to share some of my tips and tricks about pregnancy and being a dentist with all of you.
Did you have any issues specifically during pregnancy?
So, being a dentist, you're prone to backache and problems anyway, neck strain, eye strain. So, there's definitely some things that I would do differently next time. I would say do some exercises before you start your day in the morning. Try and get in about 15 minutes early. Plan your day so you've got good rests in between. You don't want to be doing root canals and surgical extractions back to back. It's nice to have a few checkups in between. Tell your supporting staff, so your nurses, your reception can support you in booking the correct appointment time, zoning your diary, and your nurses can sort of support you in giving you instruments and giving you time in between patients as well. The other thing I'd say is buy some loops because you certainly can't be as close to the patient as what you used to be. So if you have some loops, that certainly helps to keep your back straight and your posture. Make sure you have little snacks during the day like nuts and bananas and sip your water during the day as well to keep yourself hydrated and keep your energy levels up.
Have you experienced anxiety with breaking the news that you were pregnant?
So, when you become pregnant, it's certainly very exciting news for yourself and your partner, and you can feel anxious about telling the people around you. You could think, oh my God, what will my boss say? Will I still have my job at the end? Will my patients still, what will they say? So, yes, it is an anxious time. I would say then just gather yourself, know what you want to say, give your boss plenty of time to get your replacement in for you so that there's somebody to cover your patient. So when you start telling your patients, you can say, oh, yes, this lovely person's going to be covering me. And then if you want to go back, then discuss how you're going to come back into dentistry as well. It may well be that you might not want to go back 6 days a week or full time. You then may want to do part time. And there may be different options, but I think communication is very important for that.
How is pay affected during pregnancy?
So pay is one of the big things that I really wanted to know about. There are two things. There's maternity allowance that you get from paying your superannuation through HMRC. Maternity allowance can be paid up to 11 weeks before your due date and up to 39 weeks after you've had your baby. You have to call HMRC to organise this, and it's about £140 a week. The other thing is the maternity pay through the NHS. So if you are an NHS dentist, then you have to check your net pensionable earnings. Make sure these are correct and you can check these on your compass. Once you check these and everything is fine, there are a few other rules and regulations. For example, you need to be working on the NHS for at least 2 years. This doesn't necessarily have to be in the same practice, but it has to be 2 years on the NHS. Other than that, you have to be actually working on the NHS when you fall pregnant, and I think about 2 weeks before you fall pregnant, in fact. And then you must work continuously on the NHS without a break. For example, 6 months before you're about to give birth, you can't take a career break and say you're not going to be on any NHS contract and not work anymore because then you won't be entitled to your maternity pay. So it is really good, but you need to make sure that you don't get caught out with the rules and regulations. And it's a wonderful profession to be a dentist, and it's one of those professions that you can go back part time. So enjoy your time as well, and make sure you get a good time out.
Great, thank you for that.
Thank you.